my name is Carol Elliot. I'm an occupational therapist. I work at Children's Feeding Program in Richmond, Virginia. I have been working with children who choose not to eat for 16 years now, and of all ages, and I've been enjoying my work with that. And I'm here to talk to you today a little bit about why your child doesn't want to eat, which is quite a complex question and not so easy to answer, but hopefully we'll cover a few things today that will help with that. First of all, when your child doesn't eat, it obviously is a very stressful situation. As a parent, this is something that should just happen so naturally. It's really one of the things that we have to work minimally with our children as they grow and develop. It is not reflective of what type of parent you are. Parents that really don't do a lot of interaction with their children, as long as they give them food, they'll eat. So it's a fundamental basic function for children to want to eat. And when that doesn't happen, obviously it's very stressful. It's hard, you feel isolated because you don't have other people typically that have the same situation, because most people have children who eat, and if they can relate it all to is because their child might be picky. But as infants particularly who are refusing to eat, and you're spending so much of your time trying to struggle and trying to get them to eat, and then the next time you turn around, it's time to do it again. And you're watching your child not being able to grow and develop and feeling helpless. So the first place to kind of focus your attention is, what is going on medically? And that really is the foundation. Medical developmental delays are usually the main problem that is going on early on with children who are refusing to eat. However, although that sounds simple, it's not always so easy to diagnose because it's not always clear. Children sometimes mask their problems because they're not eating, and therefore the problem itself is not becoming as evidence. So they may have some testing being done that may all come back that it's not a problem, but there's still a problem there because your child is not eating. And then you're stuck in this situation of, I have a child who doesn't eat, nobody can really tell me why they don't eat, and I don't know how to get out of this. So first we want to try to figure out if there is a medical issue, if there's something that we can identify and treat. And if we do it early on, sometimes the long-term feeding problems can be avoided, because feeding, like all of your developmental milestones, happen sequentially, and they happen in a hierarchy. So for example, you don't just learn to walk from laying down as an infant. You're going to learn to walk progressively from rolling and sitting and crawling and standing and then walking. And eating happens the same way, and it happens really quickly in the 2 years, just like when children learn how to walk. And when they're not eating, then they miss these milestones and they get behind really quickly. And what sometimes happens is the problem is progressing, and next thing you know, your child is 1.5 to 2 years, and you're trying to feed them food that you think would be appropriate for their age, so like table foods that other 2-year-olds would be eating. However, they left off on the skill where they were just drinking a liquid, or they may have gotten stuck just drinking a liquid, or just stuck eating stage 1 baby foods, and things started falling apart when they didn't handle texture well. And time kept moving, but their skills didn't continue to develop. So that is oftentimes an issue as well, is what is the child being asked to eat? Do they have the skill to eat? Behavior, has a big piece of what's happening too. Children initially that are refusing to eat don't just do that because they want to act up or misbehave. They're trying to tell you something. They're trying to communicate that something is not right in them that is causing them not to want to eat. And as a parent, you're trying to read their cues while you're also trying to be diligent in getting them to eat something for nourishment purposes. So what happens is your natural response may be, I go to feed my child, they refuse, they cry, they vomit, so you withdraw. And you're stuck in this behavior rut as a parent of, I don't know how much to push, how much to withdraw. There's not like a book on the shelf that tells me what do you do when your child doesn't eat, and then you're trying to seek professional help on what to do in the problem. So the next thing that recommendation I'd have for you is trying to find a good medical intervention to see what's potentially going on with your child, and getting a good qualified feeding therapist who can help you and help formulate either a feeding people that are already in a feeding team or formulate a feeding team that can address the medical issues and the behavioral issues that are going on, the nutritional issues that are apparent. And feeding therapy, you know, it's not only important to start it early, but it's also important that you're getting a good match for your needs and your child's needs. And that's going to be very individualized. And, you know, finding somebody who can help you identify, is my child acting negatively during a meal because at this point that's what they've learned to do in a meal, because you're kind of in that behavioral rut, or is my child acting like that because I'm giving them table food potentially and they don't know how to eat it. So you have to figure out what is acting out behavior because it's learned and it's routine and that's what I do for mommy. But then when another neutral person comes in, they can help you identify, like, this piece of it is acting out, but this piece of it is why. And then when we figure out the whys, we can address them looking at the medical. We can look at the behavioral pieces of trying to get some structure in the meal, trying to get some positive interactions in the meal instead of the crying and the tantruming and everybody feeling in a bad place. So we want to have the meal, you know, be more positive. And then also to look at what skills were missed along the way. When they didn't develop where they should have in that period of time, what do they need to learn how to do? Can they manipulate the food around in their mouth? Can they chew? Are they, you know, should they be eating table food at this point, or do they need to backtrack and do pureed foods that are of table food, so nutritionally they're getting what they need and they're growing, but the skill and the food matches the level that they're at. So your feeding therapist will help with all of those components, and hopefully will really be able to help you to be able to handle the situation, feel much more positive about the interaction that you're having with your child over food, which you need to do more than once a day, obviously, and your child will be better, and hopefully you'll, you know, be able to then get some happy eating and get back on track. And the good thing about eating is once you know how to chew and swallow your food and you eat a decent amount, you're done for the rest of your life with it. And one of the things that, even though when you're in the midst of it, it seems just horrific, is when it starts to get better, it just kind of does, and then it just is like normal. And I meet many parents that then tell me, like, yeah, it just kind of, yeah, they just eat now, and we don't have to worry about it, and it just kind of went away. So hopefully you can get the help that you need, and things will get turned around.
We need your help. We need your financial support. You can visit our website to learn more about our organization. We want you to know more about this. Please tell your friends about it. Please be our champion. We need to spread the word, and we're relying on you.